firstly accepting that a kid have to go through a transplant process. The transplant, organ transplant term it itself hits badly to you. So again we put him up in the list of cadaver patients, and we were on the list, plus side by side his father was working on himself to be fit to be a donor. Since birth he was a normal kid having a normal childhood, but then suddenly when he turned 2 he started getting sick, and wahan se the journey have been a roller coaster for him. So in terms of his childhood became a little bit of a very traumatic one for him, because disease was overtaking him, a genetic disease, and उस वजह से उसकी life was very complicated because we were not sure कि होना क्या है, करना क्या है. So when we had his final diagnosis, and doctor told that only possible option is a liver transplant. Like there is no medication or there is no experimental thing that can be done for him apart from a liver transplant. Firstly, accepting that a kid have to go through a transplant process. The transplant, organ transplant term it itself hits badly to you, and knowing that a kid have to go through that, it was a roller coaster in terms of emotions. It was very disturbing to know that we have to do it. And at Bansal when we reached, we met Dr. Sahota. So one thing that hit me was, ki when I told the name of the disease, when he read the report, he knew what that disease was. Apart from when other doctors were seeing the reports, they were like, give us some time, we will go through what exactly it is and then we will come to a conclusion. Here sir already knew what it was and what the solution was. So that was one thing that gained the confidence that yes, this doctor knows what he have to do and what this thing is and what the kid is going through. There are two main reasons I'll say here. One was obviously Dr. Sahota, his response, his way of treating, attending the patient. One was that reason. And second reason was myself being residing in Bhopal. And in MP, Bhopal is the only location right now where there is an in-house team. So again we put him up in the list of cadaver patients, and we were on the list, plus side by side his father was working on himself to be fit to be a donor. And finally in April he got an approval that yes, his liver is at an attainable position where he can be a donor. And finally in April 23 his transplant happened. So about the Bansal hospital and the reason why there was a confidence in this hospital. We have a lot of negative thoughts only in the beginning, but what made sure that we go through it is having the confidence in the doctor, having a confidence in the hospital that we're taking your loved one to, and secondly having a positive approach to the things that are happening, because somewhere it's the force of nature that if you are negative you will see more negative, but if you are having a positive thoughts even in the toughest situation, somewhere the positive will be attracted and you will get a positive response.